April is Esophageal Cancer Awareness Month. My name is Baiya Krishnadasan. I'm a general thoracic surgeon here at St. John's Health Center. Esophageal cancer is not a terribly common cancer. About 20,000 people get esophageal cancer per year. Because it's not terribly common, we don't have any good screening tests for it, as we do for breast, colon, and lung cancer. There are a couple of signs and symptoms I'd like to talk to you about. Esophageal cancer has become a little bit more prevalent in younger people, and we think this is primarily due to the higher incidence of reflux in patients in the Western world. And so I think it's important, if you're younger and you develop symptoms of difficulty swallowing, changes in your voice, abdominal pain, unexpected bleeding from your gastrointestinal tract, those are things we really want you to focus on and come in to see your doctor sooner than later.
My name is Claudio Sanmiguel. I'm a GI specialist. Today we are going to talk about acid reflux. Acid reflux is one of the most common complaints of my patients. About 20% of the people in America suffer from acid reflux. Acid reflux is a combination of symptoms and damage in the lining of your esophagus or food pipe, the pipe that goes from your mouth to the stomach, and is caused by stomach secretions going backwards into that food pipe that is not used to have acid. So when that happens, you can have very mild symptoms like burning sensation here. Some people might have trouble swallowing, and that is a concerning symptom. Some people may have only cough, and that is another type of acid reflux that affects basically your throat. If you don't take care of acid reflux, it can cause damage in the lining of the esophagus that can lead to narrowing, and more concerning to changes in the lining of the esophagus that is called Barrett's esophagus. And that change, Barrett's esophagus, in a small percentage, about 1% of the people, can lead to esophageal cancer. So what to do if you have acid reflux symptoms? So the best way is to try to be proactive in getting better eating habits. So don't eat too much, avoid greasy foods, and most importantly, don't eat and go to bed. Just wait at least 3 hours after the last meal before you go to bed. And the most common cause of more severe acid reflux is obesity. So the best prevention to severe acid reflux will be to lose some weight, and that will improve your symptoms and decrease your chances of having severe acid reflux. Barrett's esophagus needs to be diagnosed with an endoscopy in most of the cases, so you should contact your primary care physician or your GI specialist. If you are having persistent acid reflux, you should come and see me. We know that men have double the risk over women. We know that if you are obese, if you are a smoker, or you drink alcohol on a regular basis, and if you have family history of Barrett's esophagus or esophageal cancer.
So that combination of alcohol, tobacco, being overweight, and having ongoing reflux are common constellation of symptoms that we see in our younger patients who are getting esophageal cancer. Those patients should have an endoscopy, and if there's a mass, they'll have a biopsy and additional diagnostic tests to sort out whether their cancer is localized to the esophagus or it's spread or not. Esophageal cancer is treated essentially by 3 modalities. Surgery is kind of the best treatment for patients with very early stage disease. Chemotherapy and radiation are utilized for patients who have disease that's spread around the esophagus or that have spread through the blood. There's some exciting new therapies for esophageal cancer. In the surgical realm, which I'm particularly interested in, a robotic assisted minimally invasive esophagectomy is now the standard of care for those of us who can deliver that. It's an extraordinarily facile operation for patients to get through. In the old days, patients would be in the hospital between 1 to 3 weeks after these operations because of the size of the incisions and the amount of fluid shifts that were resultant from it. It would take somewhere between 6 to 8 weeks to recover from the surgery. Nowadays, we're able to get patients through operations robotically in about 5 to 7 days, and they get back to their regular activities in about 3 weeks. This is really important because we want people to get back to their regular lives quicker, and the robotic assisted approach helps us do that. I also think it's really important to know that the robotic assisted approach is really precise, and it gives us the best oncologic operation. So we get a really good cancer operation with the robotic assisted approach. Aside from surgery, there's some new immunotherapy and chemotherapy drugs that are being utilized at our center and elsewhere to treat patients with advanced disease or patients who've had chemotherapy and radiation and surgery and then go on to have recurrent disease. These therapies are newer therapies. We call them immunotherapies because we use your own immune system to fight the cancer, and they tend to be very effective in treating cancer.
So if you have any doubts, you can talk to your primary care physician, or you can contact Providence to get a referral to a GI specialist.
The earlier we pick up esophageal cancer, the better shot we have of getting it cured.